Hi, my name is Steve Hoffert.
And I'm Fred Emmett.
And we're the Food Pharmacist. Today we're going to talk about a subject that's got a big impact on, you'll see in the media and on the news, and that has to do with what's called low T, low testosterone, hypogonadism. Goes by a lot of different names. And just basically, Fred, in general, quickly, shortly, tell me what is low T?
Low testosterone. So testosterone is the male hormone that both men and women have. And it's measured total testosterone, free testosterone, physiological testosterone, but it's outside of the normal range, and it's been attributed to lots of health problems in the media. One particular product had over $1 billion in sales for a single product for treatment of low testosterone. So it's a huge market for pharmaceutical companies. And as you may see when you turn on your television, you see ads for low T, low testosterone, and it fixes everything. And that's what we're going to talk about this morning. Does it really fix everything? And what are some of the real causes of low testosterone?
Sure. So, you know, just in general, people in terms think of low testosterone as low sex drive, low libido. But testosterone does a lot of other beneficial things in the body. Helps with bones. There's some thoughts, if your levels aren't good, you can have an impact on cardiovascular health. It can have an impact on prostate health. It can have an impact on dementia, Alzheimer's. It can also have an impact on diabetes, blood sugar. And we're going to talk a little bit about, just in general, maybe a little bit of testosterone supplementation, but also, too, in terms of what you can do to basically naturally boost your testosterone or overcome the issue. Because it isn't just all of a sudden people started having testosterone issues. All of a sudden, we began to diagnose and look for it. But Fred and I were talking, I think it's in terms of really more an aspect of what's causing the body to have low testosterone. All of a sudden, guys who are 35 years old just don't start having low testosterone now that it's 2014. So we'll talk a little bit about that. One quick thing I will say is a lot of doctors nowadays are putting patients on testosterone. And just one thing to keep in mind, it's really important that your doctor monitors certain things once you're put on testosterone. Just really quickly, Fred, tell me a little bit about what few things we should look at if we're put on testosterone therapy.
You want to measure that your blood counts. Testosterone helps build red blood cells. In fact, that's maybe one of the benefits of monitoring is that someone that's chronically anemic, they may be benefiting by some testosterone supplementation. On that note, a healthy person that has normal blood values, red blood cells, hematocrit and hemoglobin, often termed H and H, that we can put them into a super physiological state in which they have too much red blood cells, and the risk of stroke and blood pressure issues and thickening of thick blood, if you will, can be precipitated by too much testosterone. Also, testosterone is converted naturally to estrogens, and if you have too much testosterone as the substrate, it can be converted to too much estrogen. And for males, that's not really a good thing. Males typically don't like to have to shop in the women's brassiere department because that's gynecomastia is one of the presentations of too much estrogen, also in big stomachs and so forth. So we want to monitor estrogen levels, and we want to monitor red blood cell counts.
And one thing about that too, couple months on the estrogen, just recently, I think about 3 weeks ago, a big article come out about testosterone replacement and causing increased risk of heart disease. And one of the aspects in those articles, if you look at, estrogen was not monitored or measured. And obviously high estrogen, we have males and females all need a certain amount of estrogen, but excessive amounts of estrogen actually has some negative cardiovascular effects. Also too, with high estrogen levels, it begins to affect the body's ability to bind the testosterone. There's something called sex hormone binding globulin. So when the doctor's monitoring your testosterone levels, we do want to measure a total testosterone, but probably even more important to that is what's called free testosterone, which is actually what's able to do the job. When it's bound up, it can't work, and when it's free, it can work. And that's why probably actually monitoring a free testosterone level is probably the route to go.
Steve, what are some of the treatments options? Someone has low testosterone, and we give them testosterone replacement. That's one treatment. And it's a slippery slope because my understanding that once a male is on testosterone, regardless of the replacement dose, they're going to be on testosterone supplementation possibly for life.
Right, exactly. You know, supplementing, whether it be shot, whether it be topical, whether it be sublingual, little tablets you dissolve underneath your tongue or in your mouth, you know, that cuts off your body's natural ability to make testosterone. So even if you're making some, you start doing testosterone replacement, you're not going to make any. And so that's the reason why it's really, really important to look at maybe some other methods, especially if you're a younger male. Basically, let's say, for instance, if fertility is an issue. When we give ourselves testosterone, we decrease our ability to make sperm. And so one option that we do have is to do something like HCG, which actually works in the brain to signal to the testes to basically make testosterone through basically a feedback mechanism. And also, too, though, but it doesn't decrease sperm count. So that's one option, is to do HCG. The other option is clomiphene. Clomiphene actually is a female fertility drug, but it works in the bodies, in the brain, and in the body of males, basically to cut on testosterone production without actually affecting sperm also, too. So those are two other options that we can do to increase testosterone, but actually not give testosterone itself.
What about conversions from testosterone that is converted to estrogen? That system that does that is called aromatase, and there are prescription aromatase inhibitors. But what about natural ways to inhibit aromatase?
Well, cutting fat is probably the best way to help reduce aromatase, because sadly enough, the enzyme that's responsible for that conversion of testosterone to estrogen actually is found in fat. There is a substance actually called chrysin that can be done, and there's some thoughts, if you're on testosterone replacement, you probably should be on the DIM supplement because of the increased estrogen levels. The DIM works in the liver to help push the estrogen down good pathways. But like we were just talking about, probably the biggest issue that basically comes out that gets forgotten about or that gets overlooked, or the easy thing to push to the back burner, is why do we have men with low testosterone? And one thing Fred just mentioned is we're making testosterone, but if you've got a large amount of truncal obesity or belly fat, you have a large amount of aromatase. So I would be almost willing to bet you we see it quite often. You see the guys with the big bellies, the guys with the big man boobs, and basically what happens with that is that all that testosterone the body is trying to make, the body then converts it to estrogen, and then estrogen in the male body does a lot of negative effects, and that's one of the things that happens. So anyway, but we were just talking about that. Kind of tell me your thoughts on, Fred, about low testosterone levels in men with like metabolic syndrome and effect on insulin.
Well, I personally think that the low testosterone phenomena that we're seeing is another expression of what's called metabolic syndrome. And I base that hypothesis on the fact that diabetes is a dysregulation of insulin and blood sugar, and we look at insulin as the culprit. So, or when we give insulin, are we fixing the diabetes? Yes, we're lowering blood sugar, but we're not fixing the underlying cause of why insulin's not working and why the cells are not responding to it. And this syndrome is a disease with subsets of symptoms, and I personally think that this low T phenomena is an expression of males and maybe females, but males are what we're talking about today, of metabolic syndrome. And in the seminar that Steve and I attended this week by our friend Bruce Biondo, who's an expert in the field of male andropause, every single slide that talked about the treatment had diet and exercise as a component. And my feeling is that that's the big component. That's the elephant in the room that we don't really address as a treatment, because it's difficult to make lifestyle changes. Diet, what kind of diet? How much exercise? Well, we have always a topic of discussion. But in treatment, that is the keystone, the cornerstone of treatment of low testosterone. You have to address diet and exercise and lifestyle changes and reducing the effect of insulin and sugars and stress.
Right, and that's exactly it. Under stressful conditions, our body's more worried about, quote unquote, saving ourselves from the tiger and living. It's not worried about digestion. It's not worried about reproduction. It's not worried about making hormones that are necessary for those events. It's more worried about staying alive for right now. And you're right, whether it be stress from, emotional stress from parents, kids, families, whether it be stress from bouncing blood sugars that bounce up and down all day long. I mean, all that contributes to issues that can create a low testosterone environment in the body when really there's not an issue with production. It's just the body is being told by the brain, hey, I'm not worried about that right now. I got other things to worry about.
And again, that's part of the metabolic syndrome. I think metabolic syndrome is just a human expression of the body. Our body's wanting to hibernate. And when you're wanting to hibernate, fertility gets put on the back burner. We don't need that to survive. And so the sex hormones, whether it be estrogen, progesterone, and testosterone, get turned down. And that's my feeling on the low T phenomenon.
Very good. Well, like you said, thanks again for tuning in today. Sorry it's been a while since we've been back, but we'll get back with topics. If you have any topics you'd like to contact us with, you can contact me at steveh@magnoliapharmacy.com.
And you can reach me at fred.e@magnoliapharmacy.com.
Thank you and have a great day.
Thank you.